Ayad from Moralton. How does it feel for me? February 2026. In this video, Ayad talks about preferred scheme. A preferred scheme is when a person chooses a different support option that better meets their needs. Ayad chose an extension instead of a lift and must fund for difference. Have there been any updates on the extension since we last spoke?
The difficulty, I think, with the extension at the moment is having to fund everything on my own and then afterwards being able to get reimbursed by social services. A lot of people probably don't have the ability to do that. A lot of people maybe have to go for the recommendations of of occupational therapists, which might not work for them. We were lucky enough in that we were able to afford to go for a preferred scheme because the financial support you receive towards it is equivalent to that of what they've recommended to you. And building an extension was more expensive. Going for an extension wasn't just a preference, it was a necessity, but it would have been a lot more helpful if from the start we were told that if you decide to go for a preferred scheme, then you'll have to fund it before we can release any funds to support it. I think in that came a considerable amount of stress, thinking about how it's going to be funded, how life is going to work, given that you're putting so much money towards this.
Could you share your experience of being in a clinical trial?
I usually attend my MS clinic in Seacroft Hospital. I recently started as a participant on a particular trial for my condition. My consultant is actually on the trial. In theory, he shouldn't be seeing me as patient because this is a trial which is supposed to be blinded. So the consultants and patients don't know who's involved and what's going on. But they hadn't communicated between the trial staff and my care team to make sure that I wasn't on that list anymore. And so I ended up receiving an appointment to see my consultant on my original clinic list. And it was only when I got to a hospital and sat down in the waiting room that somebody came out and told me that I should have been taken off this list, and that appointment shouldn't have been sent out to me. In my mind, I just kind of had frustration about like the waste of time, the waste of energy and the effort getting there and everything. Even the payment for parking, unfortunately, that communication wasn't there. And I ended up being the one to take the fall for it, and I was the one that had to pay for it. I imagine that for a lot of people who hear this story might be turned off being a part of a trial, knowing that they might have to experience the same difficulties that I experienced, which is a shame because I know that research teams put so much time and effort into recruiting participants for the trial. And for something like this to happen almost breaks trust with the research team.
Can you tell us about your community dietitian appointment?
So I recently had an appointment with Leeds Community Healthcare Dietitian. As a first appointment, it was done over the phone. They want to know your weight to be able to know where to go from there. Obviously, me in a wheelchair, it's very difficult for me to weigh myself. So I don't actually know what my weight is. I almost felt like a wasted appointment because a lot of the design of your healthcare depends on your weight. If the appointment happened in person, I think they would have been able to weigh me with the appropriate equipment. But I don't think there was any kind of acknowledgement that I was a wheelchair user and that I might need some different form of support. I guess it's very difficult and very frustrating that you have these appointments and the healthcare practitioners themselves are not aware of your circumstances.
What improvements would you like to see in your healthcare services?
One thing that I would like to see differently in the healthcare system, in the social care system, is better continuity. A lot of the time when I speak to different healthcare professionals, I feel as though I'm repeating myself a lot. I have to explain my situation to them. It would be useful if the healthcare professionals knew certain things about me beforehand. A lot of the time I get handed off from one person to another, and there's very little kind of information that gets sent to the other person. And I have to fill in those gaps. If there was some sort of note or profile on the system that this individual is in a wheelchair, it automatically, I think, changes the whole dynamic of the conversation, of an appointment, especially if it's a phone call. For it to be known by any health professional who sees me that this individual is in a wheelchair, and for there to be that continuity from one professional to the other, I think would kind of avoid a lot of inefficiencies, and allow the healthcare professionals to have a better idea of how to conduct an appointment or a conversation.
Is there anything that you really valued in your healthcare services?
Almost every time I encounter a healthcare professional or just a professional that works in social work, I always appreciate the way in which they conduct themselves, the kind of the time and the patience they have speaking to me. I understand that it's more of an issue with the system than with the individuals.
If you would like to share your story, please contact Healthwatch Leeds. Telephone 0113 898 0035. Text phone 07717 309 843. Email info@healthwatchleeds.co.uk. Thank you to Ayad for sharing his story. Produced by Healthwatch Leeds in collaboration with Ro Lara. With thanks to Matty Birchall for providing voiceover.